Good evening. My name is Bartholomew Sevier. You've probably heard a lot about the Adorable Care Act recently in the news. Many of you have probably seen the marketing for adorable little hamsters and kittens dressed as patients in support of the Adorable Care Act. This particular advertisement hosts an adorable little puppy, and to the right of it says, "Be as happy as this puppy, #GetCovered." Well, the Adorable Care Act is better known as the Patient Protection Plan, or the Affordable Care Act, or better yet, Obamacare. Now, Obamacare is just recently signed into law. It is our nation's new healthcare system. A lot of people are not really sure where they stand on the issue of our healthcare, and many people think it's socialized healthcare, but really the Obamacare Act goes to address a lot of problems that we've had with our nation's healthcare policy. For one, our nation's healthcare policy was too expensive for the government. It is rated as one of the worst among developed countries in the world for price and quality. And it is also way too expensive to the American citizen and doesn't give you enough freedom or protection. So the Obamacare Act is really focused on reversing the enormous cost to the government. And that's the cost of healthcare. So whether you want to call it the Adorable Care Act or the Affordable Care Act or Obamacare, really it's the first significant overhaul in our country's healthcare system since the introduction of Medicare and Medicaid in 1965. Our country's healthcare had really become a major issue. In 2010, 45 million residents, American residents, were uninsured. Now, furthermore, 36.6% of Americans were underinsured, as well as millions of Americans that were unemployed. Unemployment rates were soaring after one of the country's greatest economic depressions, and unemployment meant that people no longer had access to employer-subsidized insurance policy or programs. And with millions of Americans underinsured or uninsured, really, if they get hurt, they still need to go to the hospital. And that cost was being absorbed into the healthcare system. The country was looking at a massive healthcare cost inflation, both to the government and the individual, at a time of already soaring national debt. In 2010, there was a 3.9% increase in healthcare costs to the government. That's a 3.9% healthcare inflation. Now, however, the Affordable Care Act is estimated by the Congressional Budget Office to reduce the national deficit by $210 billion by the year 2021. That's a lot of money, $210 billion. Now, if we're going to talk about cost or money, you have to talk about the state of the national healthcare system and what that price gets us. The United States is ranked as one of the worst developed countries for healthcare costs and quality. According to the World Health Organization, the mixed private and public healthcare system in the United States is the most expensive in the world. Not only is our country's healthcare system the most expensive in the world, but it lags far behind other developed countries in quality of healthcare. Really, the United States actually ranks last among other wealthy countries in terms of quality of care, according to the World Health Organization. Now, in addition, Obamacare decreases the cost of insurance to the citizens of the United States and makes insurance policies affordable, as well as protecting them inside of those health policies. The out-of-pocket spending grew 2.8% in 2011 to $307.7 billion. That's a huge amount of money. So the really that reflects the highest cost sharing and increased enrollment in consumer direct health plans. So in order to reduce cost subsidies, there will be provided to those who are eligible. Regulations from the government are intended to reduce the price through competition, and will make the plans and prices more transparent, and the price comparisons more accessible for consumers with online information. So federally approved multi-state plans will be phased into state exchanges to help guarantee enough options and price regulations that will be the price regulations that will be implemented. So above all this, what we're really saying is that the government will regulate both the cost and the service that the person will receive for their health care plan. And the law also allows children to stay on their parents' insurance plan until the age of 26. So this is huge for people who are going to college and need health care and don't want to pay out for huge unsubsidized policies that are given through the school itself. So if we implement these CARE Act, if we really work to implement this CARE Act and lead others to commit to buying Affordable Care Act before the March deadline, because after March deadline there will be penalties involved, we really are looking at a decrease in the amount of money that we pay in healthcare costs, both as a nation and individuals. We can move to bring healthcare quality in the United States back to where it should be, and to protect the people who need it the most. So, really, I encourage everyone to research Obamacare, decide for yourself what you think is right for the country, but most of all, get into the debate surrounding our country's future in regards to healthcare and other reforms, and go to websites to find out more information about this. Last but not least, really sign up for healthcare. And the best way to do that, and the best way to find out more about our new national healthcare policy, is through healthcare.gov. Thank you very much.